Have you ever noticed a sudden change in your bathroom habits and thought it was just your bladder or perhaps just a frustrating sign of getting older? What if I told you that those embarrassing leaks or that sudden inability to go might actually have nothing to do with your bladder and everything to do with your spine? It sounds a bit scary, but what if your back is trying to tell you something life-altering right now? It might not just be aging, and there could be a specific hidden culprit in your back causing your discomfort, one that almost everyone thinks is just a normal part of growing older. In this video, we are going to uncover the top 5 spine emergencies that reveal themselves through bladder problems, and I will show you exactly what to look for so you can protect your mobility and your independence. By the end of our time together, you will know how to spot these red flags before they become permanent, and you will feel empowered to take charge of your health, because growing older does not mean giving up. It means using smarter strategies to stay strong. Before we jump into these critical signs, if you care about staying healthy and independent, consider subscribing to our channel and turning on notifications because we share the kind of senior health tips doctors often overlook. And let me ask, are you watching from the US, the UK, Canada, or somewhere else? Drop a comment below with where you are from, because I am always curious how far our senior health community reaches. It is so wonderful to have you here with us. The first emergency we need to talk about is something called Cauda Equina Syndrome. This sounds like a complex medical term, but it actually refers to a bundle of nerves at the base of your spine that looks like a horse's tail. These nerves are responsible for sending messages to your legs, your feet, and most importantly, for our discussion today, your bladder and your bowels. Imagine your spine is a major interstate highway, and these nerves are the exit ramps that lead to your most vital organs. When something heavy like a massive slipped disc or a sudden injury happens, it can literally crush these exit ramps. The science here is quite simple, but the stakes are high. When these nerves are compressed, the electrical signals from your brain cannot get through to tell your bladder to empty. This often leads to something called urinary retention, which is a fancy way of saying you feel like you have to go, but you simply cannot. You might also experience what doctors call saddle anesthesia. Think about the area of your body that would touch a saddle if you were riding a horse. If you notice a sudden numbness in that area combined with an inability to urinate, this is not a time to wait or see if it gets better by morning. Many people describe the feeling as if they are sitting on a block of ice, or as if that part of their body has simply gone to sleep and will not wake up. I remember a gentleman named Arthur who thought he just had a stubborn case of constipation and a bit of trouble peeing because of his prostate. He waited 3 days before seeking help, and by then, the pressure on those nerves had caused permanent weakness in his feet. If he had known that the bladder issue was a direct signal from his spine, he could have had surgery within the first 24 hours and walked away with full function. The takeaway here is that any sudden loss of bladder control combined with numbness in your private areas or inner thighs is an absolute emergency. You should head to the emergency room immediately and tell them you are worried about your spine. It is not too late to make a change if you catch it early, and acting fast is the best way to ensure you keep your freedom to move. Moving on to our second emergency, we have to look at something that happens a bit higher up in the body, which is cervical myelopathy. This occurs in your neck. It might seem strange to think that a problem in your neck could cause you to have an accident or lose control of your bladder. But remember that the spinal cord is like a high-speed fiber optic cable. If you kink the cable at the very top, the signal will not reach the bottom. As we age, the canal that holds our spinal cord can narrow due to arthritis or bone spurs. This is often a slow process, but it can reach a tipping point where the cord is being choked. The science behind this involves the long tracts of the spinal cord that control the autonomic nervous system. When the cord in the neck is squeezed, it can cause the bladder to become overactive or spastic. You might feel a sudden, uncontrollable urge to go, and you might not make it to the bathroom in time. You might also notice that your hands feel clumsy, or that your balance is off. Imagine trying to button a shirt or pick up a coin and finding it nearly impossible. This is often accompanied by a heavy feeling in the legs, almost like you are walking through deep water. Studies show that seniors who undergo decompression surgery for this condition can see a significant improvement in their bladder function and their walking ability. I want you to picture your spinal cord as a garden hose. If someone steps on that hose in the driveway, the sprinkler in the backyard stops spinning. Your neck is the driveway, and your bladder is the sprinkler. If you are noticing that you are tripping more often and you are also having new bladder leaks, do not just assume it is a normal part of being 70 or 80. Mention it to your doctor specifically as a potential neck issue. Small tweaks in how we monitor our bodies can lead to giant strides in our long-term health. If you are finding these tips useful so far, please give this video a thumbs up because it really helps spread the word to other seniors who might benefit. And if you have not yet, do subscribe for more little-known health insights. We are just getting started on this list, and I want to make sure you have all the tools you need to stay active. Our third emergency involves something that often develops quietly but needs urgent attention when it affects the bladder, and that is a spinal tumor or an infection. While this sounds frightening, please remember that knowledge is power and being aware allows you to take action. A tumor or an abscess in the spine can put direct pressure on the spinal cord or the nerves exiting the spine. What makes this a spine bladder emergency is the pattern of the pain. If you have back pain that is worse when you lie down at night and it is accompanied by a new onset of bladder incontinence, your body is waving a red flag. The biological reason here is that tumors or infections can cause inflammation and swelling that takes up the very limited space inside your spinal canal. This pressure disrupts the delicate balance of the nerves that tell the bladder wall to relax or contract. A study published in the Journal of Neurosurgery found that early detection of spinal compression from these causes is the single most important factor in whether a person regains their ability to walk and control their bladder. You might notice that the pain feels deep and aching, unlike a typical muscle strain that usually feels better when you rest. Think of it like a house where the foundation is being slowly moved by tree roots. At first, the windows might just stick a little, but eventually, the plumbing stops working. In this metaphor, the plumbing is your bladder. If you have a history of cancer, or if you have recently had an infection or a fever along with new back pain and bladder changes, please do not brush it off. It is better to get a scan and find out it is nothing than to wait and lose your mobility. You are worth the effort of getting checked out, and your independence is worth fighting for. Fourth on our list is severe spinal stenosis with neurogenic claudication. Now, many of us have been told we have some stenosis, which is just the narrowing of the spaces in the spine. For many people, it is just a source of nagging back pain, but it becomes an emergency when it begins to affect the nerves that serve the bladder. This usually happens when the narrowing becomes so tight that the nerves are starved of blood and oxygen, especially when you are standing or walking. When you walk, your nerves require more blood flow. If the canal is too tight, it acts like a tourniquet. You might find that you can walk for 5 minutes just fine, but then your legs feel weak, heavy, or tingly, and suddenly you feel like you might lose control of your bladder. This is called neurogenic bladder secondary to stenosis. It is your body telling you that the nerves are reaching a point of exhaustion. Research from the North American Spine Society suggests that when stenosis reaches this level, physical therapy can help, but surgical consultation is often necessary to prevent permanent nerve damage. Think about an old electrical wire that works fine until you turn on the air conditioner and then the circuit breaker trips. Your legs and bladder are the appliances, and your spine is the wiring. If the circuit keeps tripping every time you take a walk, it is time to call the electrician, which in this case is a spine specialist. You do not have to live in fear of having an accident every time you go to the grocery store. There are treatments available that can open up that space and give your nerves room to breathe again. Growing older doesn't mean you have to accept a life of limited range and constant worry. Finally, our fifth emergency is an acute central disc herniation. We have all heard of a slipped disc, and usually it causes pain that shoots down one leg, which we call sciatica. While painful, sciatica is rarely an emergency. However, if a disc herniates straight back into the center of the canal rather than to the side, it can compress the entire bundle of nerves at once. This can happen suddenly, perhaps after lifting something heavy or even after a forceful sneeze. The immediate result is often a sudden loss of the ability to urinate or a sudden loss of bowel control. This is a massive mechanical failure of the spinal system. The pressure is so great that the nerves are essentially paralyzed. Imagine a heavy tree branch falling across a power line. The lights go out instantly. This is what happens to the bladder when a central disc herniation occurs. You might feel a sharp pop in your back, followed by a strange numbness that spreads through your legs. I remember a woman named Martha who was moving some heavy flower pots in her garden. She felt a sharp pain, but tried to power through it. By that evening, she realized she had not used the bathroom all day, but her bladder felt painfully full. She could not get the muscles to work. Thankfully, she called her daughter, who recognized it as a potential spine issue. Martha had surgery that night, and within a week, she was back to her normal self. The lesson here is that a back injury that results in bladder changes is never just a simple strain. It is a sign that the master control system of your body is under siege. You don't need to overhaul everything overnight, but paying attention to these sudden changes can spare you a lot of pain and long-term disability. I hope you are taking notes because this is a lot of information to digest. If you are finding this helpful, please tap that like button. It lets me know I am helping, and it helps other seniors find this video so they can protect themselves too. Remember, it might feel a bit unsettling to learn all this, but knowledge is power. Now that you know these signs, you can make informed decisions to protect your health. So let us recap the main points we have covered. First, watch for Cauda Equina Syndrome, which is that horse's tail of nerves being crushed, causing saddle numbness and an inability to pee. Second, keep an eye on your neck because cervical myelopathy can cause sudden bladder urges and clumsy hands. Third, be aware of deep night pain combined with bladder issues as it could point to a tumor or infection. Fourth, notice if your bladder control slips only when you are walking or standing, as that could be severe stenosis. And fifth, be alert for a sudden back injury that immediately stops your ability to go, which points to a central disc herniation. The common thread in all of these is that your bladder is often the canary in the coal mine for your spine. Because the nerves for the bladder are so delicate and located in such a vulnerable part of the spinal canal, they are often the first to show signs of trouble when space gets tight. It is about giving your body what it needs and avoiding the mistake of ignoring these sneaky signals. I know that getting older can feel like a series of challenges. The aches, the stiffness, and the fear of losing your independence can be heavy burdens to carry. But I want you to hear this clearly. You are not alone in this, and it is not too late to take action. Your body has an incredible capacity to heal and adapt if you give it the right care at the right time. Every time you listen to your body and advocate for your health, you are taking a stand for your future. You are choosing to stay in the game, to keep walking, to keep traveling, and to keep playing with your grandkids. Imagine yourself 6 months from now, walking up your porch steps with ease and confidence because you took care of a spine issue before it became a crisis. That is the power of being proactive. Growing older is inevitable, but growing weaker is not. You have the strength and the wisdom to use these smarter strategies to your advantage. Now, I would love to hear from you. Which of these 5 signs surprised you the most? Have you ever experienced a back issue that affected other parts of your body? Share your story or any questions in the comments below. I read every single one, and we all learned so much from each other. Your experience might be exactly what someone else needs to hear today to feel less alone. If this video helped you or opened your eyes even a little, please hit the like button. It really means a lot to our community. And do not forget to subscribe and turn on those notifications so you never miss out on these important health insights. We have so much more to share with you about thriving in your golden years because your health and your independence are worth fighting for. If you are still with me and determined to stay strong and informed, type a 1 in the comments to affirm it. It is a simple way to say, I am taking charge of my health today. Keep taking those small steps for your health. They truly do add up to giant strides in your freedom. Stay strong, stay healthy, and remember that your independence is carried by the strength of your spine and your willingness to listen to what it is telling you. I will see you in the next video.